Good afternoon. My name is Tyler Marsh, and I'm the Medicaid coordinator for the Colorado Department of Education. And I'm pleased to bring you the updates of annual training for 2024. And if I haven't met you yet, again, my name is Tyler Marsh. I hold a master's in public health, and I have experience in over 20 years of healthcare and hospital experience, summarily in Denver Health, Children's Hospital, Colorado, as well as the Department of Healthcare Policy and Finance. My specialties are in Medicaid billing, as well as clinical workflows and a project known as value-based payment reform for behavioral health safety net in the state of Colorado. I do hold a master's in public health and a bachelor's in political science. For the components of this training, we are going to cover three topic areas: the local services plan, the reimbursement spending report, as well as parental consent forms. For our three components, we have the LSP, and this informs CDE how Medicaid reimbursement dollars will be spent in a 5-year period. If you do not know which cohort you are in, please contact me after the training, and I'd be happy to help you, as well as assist with whichever district you are in to help complete that. The second component is a reimbursement spending report to the Colorado Department of Education. This is an annual report that informs CDE and Healthcare Policy and Finance how Medicaid reimbursement dollars were spent in a given fiscal year. And lastly, we'll be covering parental consent forms, and these give consents for districts or boards of cooperative educational services to inform CDE as well as HCPF during a comprehensive review period. So for our first item, we covered the LSPs. These are developed every 5 years, with our current LSP beginning on July 1st, 2024 through June 30th of 2029. These are developed by our community input with your health and wellness advisory and/or committee meetings. The main goal of this is to identify and prioritize the met health needs of students and/or future health needs of students and their populations. If this is new for you, you can skip the second point, but if this is a continuing year, it will be determined by your district LSP budget based on cost reconciliation from previous years. As you think about submitting your LSP, you're going to complete a full submission with every component of the LSP we'll discuss in a minute, as well as a signed assurances page. And you'll email the final LSP to myself at marsh_t@cde.state.co.us. The components of this LSP are 5 parts, namely a cover page, which includes the title and name of the person submitting the LSP, as well as contact information. Part 2 is a community health needs assessment, also highlighting Part 2B of the uninsured or underinsured health needs assessment of your students and population. Part 3 primarily concerns costs, itemized by administrative costs, health services costs, as well as expenditures by CDE categories. Part 4 is the goals and objectives, and Part 5 is this assurances and signed documents. As we discuss the idea of community input, it's important to consider goals and objectives, which is our lower circle down on the bottom left. And your goals and objectives should align with the middle circle of health services categories, and ultimately should align with the overall circle of your community health needs assessment. As you go through creating an LSP, there's some important things to consider, namely allowable expenditures. If you are concerned about what this means, you can consider 1, these must be spent on a health need, used for health services for one student or many or all students, and cannot be spent on purely educational expenditures. And 2, it must align with the Board of Cooperative Educational Services or your district LSP. It must align with community identified health needs and also align with selected health service categories. If you feel that you've submitted an LSP that needs to be revised, this is an opportunity to revise said LSP at any time. This is open throughout the year, and if you feel that your district needs a revision, we ask that you provide us the original document of your LSP, as well as a companion form of the LSP with your anticipated changes. You'll submit them to my team, and we'll be back with you to review those changes and hopefully get that approved. For your LSP, here are the due dates that are helpful. If you have an LSP that is ending June 30th of 2025, we ask you to submit your initial review draft for that new LSP on June 16th, 2025. This will give us a 2-week turnaround for edits as well as revisions from our end, as well as contacting your district for a final submission of June 30th, 2025, and a go live date of July 1st. If you're unsure of your LSP cohort, please find this QR code on the bottom left, or you can also visit the CDE SAH program timeline on this webpage on this slide. The next component that we'd like to talk about and present today is reimbursement spending report. Again, as we talk about LSP, this is a 5-year plan for prospective costs. When we talk about reimbursement spending report, this is a one-time annual report of spending that has actually been done over the past fiscal year. Again, this also includes 5 components, but one, similar to the LSP covered page, is general information, name of your district or BOCES, and your coordinator contact information. 2 will be administrative expenditures, and these are specifically reimbursement dollars spent on program administration. 3 are health service expenditures. These are dollars spent on health services to students by those 6 CDE categories, and/or FTE count is also requested in this. 4 would be the summary of your total expenditures. This is administration and health services. And 5 is your annual notification and intent to continue participation. This report, again, is due every year annually, and that report opens on October 1st, 2024, and closes on February 28th, 2025. As you're going through the reimbursement spending report, if you need more help on some of these boxes, you can hover over that question mark in each of these categories, and it will give you more specific prompts, and/or if you would like to talk about any success stories on spending by category, you may include that in this section. These are some data points that are helpful to highlight as we look at the overall growth of this program. As I'm relatively new to school health services, I'm encouraged as we start on the right, looking at the fiscal year 2021 through 2022, and then moving to the left, fiscal year 22 through 23, we see an overall increase in administrative spending, health services, and I really look at the bottom left. Total FTE hired. We went from 25 in 2021 fiscal year to over just under, 900 FTE. This really gives me an idea of not just the nurses, but overall the personnel that are really contributing to improving student health statewide. This is an overall breakdown by category that we see in the 6 categories of LSP, as well as reimbursement spending report. And we see a large proportion in nursing services. This is FTE nurses or nursing care and/or claims, and a large majority in total FTE. And this is fiscal year 2022 through 2023 reimbursement spending report by state, by category. So again, this is just an aggregate of where the majority of our dollars and/or FTE lie. This is an indication of a 6-year historical growth of this program. Starting on the bottom left, we have fiscal year 2017. Moving to the right, we have fiscal year 2022 through 23, with a starting amount of 37 million, moving up all the way to 2021, peaking at 66 million spending, and dropping down a little bit at fiscal year 2022 through 23 of 64 and change. As you go through a reimbursement spending report, if you find that you need additional resources or help, again, you can reach out to me directly, or you can also visit our CDE website, and you find these 4 items which are particularly helpful. We have the reimbursement spending report guide, category transition document, expenditure allowability, and the narrative support. The last item we'd like to touch on today is parental consent. At the Colorado Department of Education, we are tracking national legislation that is moving to identify and/or revise some of the excerpts under IDEA, and we'd like to give you this information regarding school health services. Prior to accessing child's or parent's public benefits for the first time, a public agency must obtain written parental consent, informing parents of what personally identifiable information, or PII, may be disclosed. This is required under the Family Education Rights and Privacy Act, also known as FERPA. A public agency must also provide notice to parents of their rights under the Individuals with Disabilities Education Act, IDEA, including the right to the following: not be required to enroll in Medicaid to receive special education services, not incur out-of-pocket expenses, not have the child services affected if consent is refused, and the right to withdraw or refuse consent at any time. As we discussed parental consent reminders, this is helpful that these parental consent forms concern the disclosure of PII necessary for billing purposes. This is not a consent to bill Medicaid. If you have any questions regarding this, we encourage you to contact your local district legal team and or your district BOCE consent processes. For the last item in our training today, I'll be discussing CDE parental consent review. These are required under participation in this program. And if you find that your district is selected, the CDE reviewing period will begin on January 1st, 2025, and will conclude on February 28th, 2025. If you find that your district is selected, you will receive an email from myself as notification, as well as a second email from the email we have on the slide, notify@transfer.cde.state.co.us. And important to remember, we only send responses through and parental consent through the CDE Secure File Transfer tool. So I've gone over a lot of information today, but I just want to give some helpful reminders on dates. The reimbursement spending report is due by all districts on an annual basis, and you'll submit that to the Colorado Department of Education. That report opens on October 1st, 2024, and is due on February 28th, 2025. For the local services plan, if you know that your district is ending in June of 2025, your initial review is opening on June 16th, 2025, open for a 2-week time period with a final submission of June 30th, 2025 for a go-live date of July 1st. As we go into an LSP and or a reimbursement spending report, if you do need more support, you can always visit the CDE website for school health services, and you're going to scroll down until you find on the bottom left program learning tool. This will give you a comprehensive overview of the program, as well as details and or help and review pages. And at this time, this is the end of my presentation. Thank you so much for your attention, and I look forward to working with you.